Let's go to Victoria now and catch up with Liberal Senator for that state, Sarah Henderson. Thanks for joining us, Sarah. I know that the federal government has strongly urged its members not to be too critical of Dan Andrews, but are you worried? We'll talk about the implementation in a moment, but are you worried that this lockdown is just too severe, too extreme, especially the curfew impinging on people's freedom?
Well, Chris, good afternoon. And as we know, we have a state of disaster in Victoria and we have a deeply concerning situation. And as has been made clear, we regrettably accept that these very tough restrictions are necessary. I'm pleased to say, Chris, that in regional Victoria, where I am based, we don't have stage 4 restrictions. We are going to stage 3 tomorrow night. But it is deeply distressing for families, for people trying to run their businesses, for people who have lost their jobs. And at this stage of what is a crisis, the Morrison government stands shoulder to shoulder with the Victorian government to do everything we can to get people through this.
So what does getting to the other side involve? Getting to the other side really just means getting back to where Victoria was 6 or 8 weeks ago.
Absolutely, Chris. We had a strategy, an aggressive suppression strategy that was working. And as we have heard in the Senate COVID inquiry today from Brendan Murphy, it is clear that the very high level of community transmission in Victoria has led to this crisis. We had a plan, and of course, if that plan had been executed properly, if we had not have had the scandal with hotel quarantine, we would be in the same position as other states. But we now have to deal with what is before us, and that is a very, very serious situation. And I'm living and breathing it. Chris, I'm in quarantine at the moment after coming into contact with a COVID positive person. And I have seen firsthand where the contact tracing and where some of these IT issues are going wrong, even in my own experience.
We have to talk about what's sustainable. We haven't got answers from our politicians in many months now as to what sort of level of infection, what infection rate in Australia is sustainable. We were told we needed to more than triple our critical care beds. We did so. We now have 7,500 of them available in Australia, thinking that that's what we would need. We've never used more than 100 of them at a time. At what point do we get a straightforward response from premiers and prime ministers about the level of infection we will tolerate before we try and shut down the country again? Because you must know that this is unsustainable for people, for families, for businesses, for communities.
Chris, there is absolutely no doubt. This is absolutely unsustainable, what we are enduring in Victoria, and that's why we must aggressively suppress this virus. And of course, an enormous amount of work is going into developing a vaccine. That is obviously critically important work. But the current situation in Victoria is untenable. We have to get these numbers down. We are working incredibly hard to do so. Of course, the more active cases in the community, the more deaths there will be in our state. And we just cannot let that happen, Chris. So, as I say, we are working shoulder to shoulder with the Victorian government. But as we've heard today in the COVID inquiry, due to the hotel quarantine issues and now due to the issues, the very significant issues with contact tracing, there is a particular problem, and there has been a very serious problem in Victoria, which we are now working hard, very, very hard with the Victorian government to remedy.
Well, that is the trouble. Instead of fixing quarantine problems, fixing aged care problems and fixing contact tracing, the whole state is paying an enormous price. Now, you're currently in isolation because you've been in contact with a positive case. Your experience of contact tracing in Victoria has taught you what?
Well, for instance, I received a message the other day saying that I needed to have a COVID test, but the data was wrong. So the wrong day was given to me and that had to be corrected. I had 2 phone calls within half an hour. So there was a problem with the IT system. There was no recording of the fact that I had been contacted. I certainly had a knock on the door yesterday from a Department of Health official and also 2 army personnel, and that was very impressive to see. But also there's a real problem, and that's now been fixed just today. People in quarantine have up until today been told that they're allowed to go out and exercise. And I raised this with my contact tracing team last week and saying, well, how can that be possible? Because if you're COVID positive or if you are a close contact, then that puts other people at risk. And that's probably one of the reasons why so many people were not home when they received at the door.
I couldn't believe that that's been fixed, yeah. But Daniel Andrews has fixed that today after he's put his Melbourne into stage 4 lockdown. He's put the lockdown in, the curfew in place, all of these incredibly extreme measures, and then he fixes that. Fixes a rule where infected people were told they could go out and wander around the neighbourhood exercising. It's extraordinary.
Well, I raised this very issue. I have not left my premises, of course, in 14 days, and I know that many people are doing the right thing, Chris, and now even more so than ever before. It's absolutely imperative that Victorians do the right thing. And, of course, some people have done the wrong thing and been absolutely in breach of the restrictions and the health advice.
Well, just before I let you go...
Clearly, there's definitely an issue with messaging, and there's another example that I've just cited. Sure,
I just think you get all these things right before you put the state into extreme lockdown, but here we are. I just want to show you the Health Minister, the State Health Minister in Victoria, Jenny Mikakis, when the upper house was sitting in Victoria today. Here's how she responded to questioning.
On what date in March or April were you advised that there were serious issues with the hotel security program?
I will take the member's question on notice, and I will provide her with a written answer.
Do you accept full responsibility for the failures in the hotel quarantine security program?
As I said, I will be providing the member with a written response to this question.
Victorians, let alone the rest of Australia, deserve to get answers in real time, don't they, Sarah Henderson?
Yes, they do, Chris. There is no doubt about that.
Thanks so much for joining us, and best of luck for the rest of your isolation.
Thank you very much, Chris. Great to talk to you.
No exercising, no ducking out for exercise.
No, absolutely not.
Sarah Henderson there, a Liberal Senator for Victoria. As you heard there in isolation, just incredible that that rule has only been fixed up now. After all this trauma, people who are infected told that, wow, you can't go out and exercise. That would be unwise. Just unfathomable, isn't it?